Helping patients with diabetes stay healthy is a complex challenge. These patients need different kinds of care, provided by different members of the care team at different steps in our daily workflows. We're going to take you through options for the different tools available to you at each workflow step. How can EHR tools help improve CVD prevention care in your patients with diabetes between visits? This is the outreach step of the workflow. Let's learn how reporting workbench and a Cure can be used at this step.
So reporting workbench rosters can be used for outreach in a couple of different ways. We can either generate letters to be sent out to patients in bulk, or you can send them a MyChart message if they happen to be active from MyChart.
For outreach, we are generally pulling patient lists, so whether that's from a Cure or from Epic, having the ability to search for specific patients is vital to care management and is therefore vital for diabetes management.
A Cure can be used in caring for patients with diabetes. You can then look at such things as whether or not the patient is on an aspirin, which would be recommended, or whether or not they've had their cholesterol checked, and whether or not they're on a statin drug. So all of those things can be looked at very specifically in a Cure.
The next step in our work is scrubbing, also known as pre-visit planning. This is when a care provider or team looks over the needs of the patients coming in that day or that week. There are several tools available for use at this step. Let's hear some of the ways that our tools could be used for scrubbing.
So the wonderful thing about a Cure is that you can look at future appointments and see what things need to be done for that patient. In order to think about scrubbing specifically with cardiovascular disease in diabetics, there are some things that you know that you want to be thinking about, specifically in regards to hypertension control and in regards to their medication management, that you can scrub.
A team could also use health maintenance alerts for scrubbing. We'll talk more about those when we move along to rooming. Medical assistants and nurses can use best practice advisories, also called BPAs, and health maintenance alerts, also called HMAs, at this step to learn about guideline-based recommended diabetes care individualized for this patient.
As a provider, the time that I have with a patient is really limited. It's really helpful to have my staff, the nurses and the medical assistants, really help me with teeing up the appropriate care for my patients. Just like I can, they can also go into the health maintenance module. They can look at the best practice advisories or BPAs that are in the plan tab and tee up orders that are appropriate for that patient, so that when I go in to see the patient, I can go into order entry and I already see that orders have been pending for me to sign. There are a lot of HMAs and BPAs that are really relevant to diabetes and cardiovascular risk management. Particularly with HMAs, you might get a prompt that a patient is due for a lipid panel, for example. In the BPAs, there might be a prompt that suggests that the patient needs to have their hypertensive therapy up-titrated.
We're now at the final workflow step, one-on-one time with the provider. The provider may choose to use the BPAs or HMAs at this step, or the CVD Risk Calculator. Let's hear how the CVD Risk Calculator allows providers to see a patient's 10-year risk of heart attack or stroke.
The CVD Risk Calculator, it takes several factors about the patient, like if they have diabetes, their smoking status, if they're treated for hypertension, and a few others, to calculate what their 10-year probability of having a ASCVD event is. This gets displayed in BPAs that the provider, as well as potentially the rooming staff like the MA, would see. In addition, it's available in the patient snapshot. So providers can go look it up on any of their patients in the appropriate age range, and it can be seen in reporting workbench, so it can be used for outreach workflows as well.
I think if you're face-to-face with a patient, it would be very useful to be able to access the calculator immediately while the patient's medical record is open. And one of the ways to do this is by doing a smart phrase, and you can pull that directly into your notes, and that will automatically calculate the risks. You can do it at point of care when you're face to face with a patient. You can do it ahead of time using patient schedule and by running reports in the reporting workbench as well.
All of the tools we shared can be used for multiple purposes within diabetes care, or even for patient care outside of diabetes. We hope we've inspired you to try a new tool today, or use an old tool in a new way.